I'm going to discuss Benmap. It is a modeling tool designed by the EPA. Benmap tool estimates the number of economic value of health impacts resulting from changes in air quality. It'll show the health benefits of improved air quality. A health impact function incorporates 4 key sources of data. It uses health impact functions that are constructed using information from published literature, modeled or monitored air quality changes, population, baseline incident rates, and an effect estimate. I'm going to show you some examples of what Benmap can do. It's also a lot like ArcGIS. You take a data set and you assign it colors and you show it on a map, and that will give you a visual of what you're trying to say. It's really nice to add to presentations for work if you're trying to get funding for something, to be able to show improved air quality versus health. You can also allow you to correlate data, so you can see that in this one the African American population and the asthma hospitalization rates correlate, and so it leaves you to ask more questions, but that's a good thing, I guess, in this situation. We have distribution of health impacts. I'm just going to show you some that have been done. So in this one, it shows you that the air quality policy reduces the number of hospital admissions by 100. It's just another way that it'll take the data set, it'll turn it into something quantifiable that you can show in your presentations. This is a data set, and this is what you'll put in. It's sort of like ArcGIS, as you put it in as an attribute table. The program calculates the economic value of quality changes using both cost of illness and willingness to pay metrics. It's assumed that the healthcare industry reporting these results have done so correctly, as well as the emissions reporting agencies. This is really important when you're working with any type of data set that relies heavily on human reporting and doing it properly, especially when you're working with things like emissions and you're depending on industry to report exactly what's going on. So you will have some error or limitation in that way while you're building your maps. You do hope that it's done properly, but I mean, there's always going to be some room for error in that sense. So some of the applications, you create population level ambient pollution exposure maps, estimation of health impacts associated with exposure to existing air pollution, estimation of health benefits or of alternate ambient air quality standards, performance and sensitivity analysis of health evaluation functions or of other inputs, and to monitor historical changes in air pollution and health. Anytime you create these maps, it allows you to track changes over a period of time. So if you want to look back over, if you're doing this for your company, you're able to look back and say, okay, these are the things that we've done to correct our emissions, to help the community, and it allows you, when you're reporting to the DEP or the EPA, to show some of the progress you're making as a company. It's really important. Here are my references. This came straight from the EPA. We work with them a lot in my company where I work. And it seems to do really well. They have a lot of really great modeling softwares, and we use them. It was just really hard to narrow it down. Thanks, guys.